As always, we have somebody who's an expert in their field to give you good, sane advice. So today we have Dr. Sirine Takieddine. She's a dietitian based in Dubai for the past 5 years, and she's changed a lot of people's lives both inside and outside.
Exactly, and it's truly inspiring to be sitting next to a lady who looks brilliant herself. Sirine, welcome to the show.
Thank you for having me.
It is our pleasure to have you on the airways of Suno 1024. And since Ramadan is on, the main problem we hear a lot about the Ramadan month is that people suffer from a lot of bloating, eating disorders, basically,
Yes.
And what are the causes, and how can one actually maintain a lifestyle to fix this problem?
Sure. So one of the main problems I hear a lot in my clinic is constipation and bloating. So one of the main reasons being that, when iftar comes, we are very hungry, so we tend to eat very fast. So we need to give our digestive system a bit of time to, to start digesting slowly, because we
You
have
mean to say chew slowly?
chew slowly and eating slowly, not very fast, because we have been fasting for more than 14 hours. So definitely eating fast plays a big role in bloating and constipation. And also drinking water. We tend to forget a lot about that, and that's a major contributor of this.
So when one breaks his or her fast, what do you suggest one should have? The first thing,
The
water?
first thing is water, room temperature. Not something that is very cold or very hot, such as having our coffee or having
A lot of
like
people
a
have
juice. That is-
juice, yeah.
Yes, because this actually shocks our stomach a bit, because as well we have been fasting for long hours. We have to take something that is kind of at room temperature also to ease the process of digestion.
And so somebody was asking me, they have gym memberships and they're very upset and confused that when do we go for the gym exercises? Do we go before iftar or do we go after iftar?
Yeah.
What is the best time for that?
So a few years back, after actually 5 to 6 years back, we used to, as dietitians, we used to say, go before iftar because it's the best time for fat breakdown. But now new studies have come up saying that actually we also lose muscles because we haven't fed our muscles properly. So for now we are advising to have it 2 hours after iftar, enough time for our body to have digested the food that we ate, and it's good for fat loss and also not losing our muscles, which is very important to try to maintain as well.
Wow. In conversation with Dr. Sirine, who's of course here to enlighten us more about Ramadan, when to eat, how does one really avoid gaining weight during Ramadan, when we come back right here with Anand and Pallavi. On Suno 1024, this is Meet the Expert right here with Anand and Pallavi in conversation with our wonderful, beautiful dietitian, Sirine. Sirine, coming back to the Ramadan, coming back to the Ramadan question, people tend to put on a lot of weight.
Yes.
So, people who've gained weight during Ramadan, what should they do to focus on and lose all that extra flab that they put on?
No,
in
first you
this
have to tell
period?
me, how do they manage to put on weight during Ramadan? Aren't they fasting for 14 hours?
Yeah.
Yes, and this is actually a major part of fasting, because our metabolism doesn't work as much. It starts slowing down, and a lot of people also maybe eat more than they should during iftar times and also suhoor times.
So let me get this straight. The metabolism slows down because you're not eating at regular intervals, is it?
Exactly,
And then when you break the fast, you tend to eat more.
To eat more. So that is a major, reason why people
Put on weight.
Yes. Some people, they lose weight, but we're seeing a lot of people who actually do gain weight. And, to lose weight after Ramadan, they should start, getting back to their normal routine, getting food to work. A lot of people, they order food, and this is a way where they can't really count their carbs and try to manage their weight. So I would advise them to get, homemade food.
Cook and eat.
Yes, cook and eat, and to control your portions as well. And have more snacks also during the day. That actually helps our metabolism to start burning out calories more.
When we're talking about healthy snacks, what do you suggest as a dietitian? What should one stick to?
Yes, healthy snacks can be something like a fruited yogurt, for example, with raw nuts, or low-fat plain yogurt with some tablespoons of granola or oats, for example. Fried fruits is a good snack. Popcorn, actually, homemade popcorn, I give it a lot to my patients. It's very high in fiber, and it tends to keep you full for a long time. So it's actually good for you.
So, in one question, since we're talking about weight loss, the labels that we find, we come across in the supermarkets, low fat,
Yeah.
low sugar.
Yeah.
Is that a done thing, or is it just a myth that, the low sugar chocolate, you will pick it up and it tastes really sweet?
Yes.
So is it good for one's diet plan, the low sugar, low fat, low diet things that are available in supermarkets so easily?
That's a great question. We have to take care of these marketing strategies, those labels, because sometimes if something is low in sugar, it doesn't mean that it's not low in fat. So they would put sometimes these labels on those products to trick us on thinking that, okay, if it's low sugar, then it's low in calories, but it might be high in fat as well. So we need to read the nutrition facts as well before, eating more of what you think is low in fat or low in sugar.
So you've been binging on those low-fat chocolates. No wonder.
All right, moving on to more general questions. A lot of people feel listless and they feel down on energy when they come to work. I know of a few people who keep yawning all the time when they come to work, and they get other people yawning as well. So how does one get rid of that?
Yeah.
How does one not feel lethargic?
It's actually very simple. You just have to eat more. So I get that a lot in my clinic, and when I do their food history, I see that they're skipping breakfast and they're skipping snacks, and the first meal they're having is their lunch, which is at 12 or 1 o'clock. So what happens is all our energy and blood goes to our digestive system, and it causes us to feel tired after a big meal. So once they start having a small breakfast and few snacks before lunch, and lowering the quantity in lunch, they would actually feel a huge boost in their energy levels throughout the day.
All right.
Wow.
Well, we have Sirine with us. She's a dietitian based in Dubai for the past 5 years, and she's helping everybody who listens to Suno 1024. She's been helping everybody who listens to Suno 1024 probably plan their diet in a better way so that they don't put on unnecessary weight.
Everybody talks about. But let's talk about weight gain.
Yeah, really.
I know people who are struggling to gain a few kilos. What would your advice be to them?
Yeah, you're correct. We always we always talk about weight loss.
Absolutely,
We always
especially
forget-
women.
Yes, women. We always forget the people who are trying to gain weight. So for those people, actually, it might be shocking for people who struggle with losing weight. People who want to gain weight, is actually more difficult for them to gain weight than people who are trying to lose weight, because usually it's a genetic thing, and their metabolism is extremely high that you can't really control their caloric intake. So for that reason, I would suggest that they would have more shakes and smoothies throughout the day, and not things that we buy from the market. It's very easy to do them at home. So ingredients can be like low-fat milk, low-fat yogurt, dried fruits, organic honey, raw nuts. Avocado has lots of calories. Mango. Have 2 to 3 a day, and with your regular meals, of course. This will help to boost the calories.
One thing I'm taking away from the conversation, Anand, is that she really insists about making stuff at home. I think
Yeah,
eating
exactly.
outside is not a very healthy option.
Not
For
very-
most of us in Dubai, we're always eating outside, isn't it?
Yes, true. Because I'm seeing this a lot, as you said. People here they work a lot and sometimes long working hours, so it's difficult to maintain. But there are easy strategies to start cooking at home, and just doing simple recipes. It doesn't have to be complicated and time consuming.
Moving on from that advice about gaining weight, now a lot of people tend to gain weight in the wrong places. Instead of having a V-shaped body, they become a question mark.
Yeah.
So what would be your advice to them?
My advice, sadly, there is no type of food, that will make you gain in certain places and lose in other places. But what can help you is a personal trainer, actually, focusing at the gym about in certain parts. So there is no food, because a lot of people tell me, I want to lose from my stomach, I don't want to lose, from my thighs.
overall.
But that doesn't work with food. Yeah, it's where your fat cells are located. This is where you will gain the weight.
When we come back, more questions right here with Sirine. In case you must be wondering that, God, I put on so much weight, what is the right time to exercise? All those questions answered right here with Meet the Expert on Suno 1024 with Anand and Pallavi.
On Suno 1024, the show is called Meet the Experts, and we have an expert on diet and what kind of food to have, what not to do, when to exercise, when not to exercise. Her name is Sirine, and she's right here in the studios. Sirine, what is the best time to exercise? Are there any rules for that? Because,
Right now.
Yeah.
1,
No.
2, 3,
The
4.
boss is going to deduct it. He said this is gym time, not studio time.
I've actually wondered, you asked such an amazing question. What is really the right time to exercise on wonders?
The right time to exercise in normal days, not during Ramadan, is definitely in the morning because it's when our body has the highest performance. But not on an empty stomach, as we discussed earlier. To have something like a small snack, something that is a good source of carbohydrates that will give our muscles energy to perform better.
Okay. What type of exercise?
The type of exercise varies from one person to person, so it depends if they want to build muscles or to do some sort of cardio. Some people, I don't recommend them to do exercise, people who have a BMI of more than 35 or 37. For our listeners, it's a very easy equation that they can do. They divide their weight in kilograms over their height in meters square, so their height times 2. They would get a number. If it's higher than 35 or 37, I do not recommend that because they would probably have lower spine problems and joint pain because, they are carrying this extra weight during the day. So for those people, I would recommend that they actually lose a bit of weight before doing any kind of fitness program, and definitely consult your doctor or dietitian before doing that.
Meet the expert right here with Anand and Pallavi in conversation with Sirine, who's a dietitian. Chalo, exercise kab karna hai, wo to hमें समझ में आ गया Anand. But what about energy drinks? We are in a profession we need to be happy, energized most of the time. So a lot of our colleagues are sort of addicted to these energy drinks, and they say it has no side effects.
I believe it has a lot of caffeine. What is the...
Yeah.
It has lots of caffeine, and just to give you an idea of how much caffeine it has, a cup of coffee has between 80 to 120 milligrams, and one of those have around, the minimum is 150 and goes up to 350, so you can imagine. And usually people who drink energy drinks, you don't see them drink one a day. They usually drink more than that because every time they drink, their body will ask for more because caffeine is an addictive substance, and once your body gets used to a certain amount, you will always need
Crave.
more and more.
Yeah.
Yes,
So
yes.
it's very difficult to stop then.
Exactly. And the side effects are really bad, especially for for people who have heart problems because it causes palpitations. Also, it causes a lot of insomnia. They can't sleep properly during the night, and actually there's a huge misconception with the energy levels. As you said, it gives us a boost for 15 to 20 minutes,
That's
but
it.
after that it goes down even lower than before you drank, and this is why you will always need more and more because you want the same effect than the first one you drank. So I would highly recommend that they start cutting down, not stopping completely because they will have like withdrawal symptoms. So just start cutting down one by one, and having like sparkling water, for example, just to give you that
Same
bubbly
taste.
that you're used to. Yeah, and just try to reach a point where you stop it completely.
So next time you're feeling low on energy, grab a banana instead of an energy drink.
Exactly.
Yeah, that's a good tip. All right, when we come back, more questions with our expert Sirine right here on Meet the Expert with Anant and Pallavi. Keep it locked only to Suno 1024. This is a separate topic, but there are certain items that in terms of the food family that one should consume on a daily basis, something which is good for one's body.
Yeah.
Can you enlighten us more on this?
These, I'd like to call them power food. I believe that everyone should have these food items in their pantry or in their kitchen. They are avocados, raw nuts, salmon, eggs, blueberries, banana, chia seeds, and dark chocolate.
I like the last bit.
Yeah, the
Dark
last
chocolate.
one. But you have to get them more than 70% cocoa because they would have the less, amount of sugar and amount of milk, full fat milks in them. So for the omega-3, definitely avocado, raw nuts, and salmon. People are scared of avocado and salmon because, that they say it has a lot of fat, but studies have shown that it actually reduces the cholesterol in the blood. So, people who have cholesterol can actually start consuming fatty fish such as salmon and tuna and sardines, for example. For the protein base, which is eggs, they are high in protein, they're a good source of iron and zinc, and especially for vegetarians because they cannot get their proper vitamin B12 because it only comes from animal sources, so eggs is a great alternative. For vegans, which they don't consume eggs, they would have to take B12 supplements because they cannot get it from vegetarian sources. For antioxidants, blueberries, chia seeds, and dark chocolates are the best kind of food. They are great for they're our heart's best friend, so they're excellent foods. Definitely lowers the risk of cancer as well. For banana, people think that banana, causes you to gain weight. Actually, it helps in our bowel movements and satiety, so it helps us in losing weight, and also regulates our heart rhythm because it's high in potassium. So
Wow.
You're on Sona 1024 with Anant and Pallavi, and we're meeting the experts. Aaj expert kaun hai? Well, we have Sirine with us. She's a dietitian based in Dubai for a while. She's been here for 5 years, and she believes that people can easily make the correct lifestyle changes without doing much halla. Okay, now we'll go with foods. What kind of foods should certain people avoid? As in people suffering from high blood pressure, low blood pressure, especially during the month of Ramadan.
Yes.
A lot of people have that question. What should I avoid? What should I eat?
Okay, so people who suffer from high blood pressure, they, think that it's only the salt that we see, so what we sprinkle on our food. But actually, there are lots of hidden sources of salt. Everything that is processed or everything that has a shelf life has salt, because salt is the #1 preservative, food item. So I would recommend them to, not buy any canned food, or even if they have to, because of their busy lifestyle, they can just, wash the ingredients, if it's chickpeas or lentils, to wash them properly before consuming them. Processed cheeses have lots of salt as well, so we should take care of that. Also, pickled items such as olives and pickles, all of these are high in salt. Even things that we wouldn't think of, like sugary cereals, for example, they are really high in salt also, because their shelf life is high. So, rule of thumb, everything that has a shelf life is very high in salt. So try to avoid also the, packaged foods such as soups and all the frozen foods also.
Yeah, the instant noodles.
Yes,
and
exactly.
in the Asian community, we have a lot of pickles.
Pickles, these are very high in salt as well.
Talking about high blood pressure, let's move on to a bigger topic, diabetes. Is diabetes a preventable disease, and how can one prevent it? Do you think food plays an important role in that?
It does. In most cases, diabetes is definitely preventable. Not always. There is a genetic factor as well, but in most cases it is. And not just, healthy lifestyle, also to keep our weight in check. The more weight we gain, we are at higher risk of developing diabetes and high blood pressure and heart problems. So leading a healthy lifestyle means that you should try to do, more cooking at home, switching certain items such as from full-fat dairy to low-fat dairy, because people think that if I'm diabetic, I should take care only of the, sugar, which is not the case. There are other things also that can contribute to diabetes. So also changing from refined carbohydrates to whole wheat as well, that helps.
Hold on to that thought, Sirine. Well, we are in conversation with Sirine, who's a dietitian here, based in Dubai. Meet the expert में आपके भी सवाल हम सारे आंसर करने वाले हैं बस थोड़ी ही देर बाद. Once you get diagnosed with diabetes, coconut oil, that's a new thing. A lot of people are switching to coconut oil. Is it a good oil to cook in?
Yeah, studies for now did not really, say if it's good or not. For now, what I say is, you can have it once in a while, but don't just stick to that, because you have other sources like canola oil, which is very high in mufas and pufas, which are the healthy fats, sunflower, safflower. So try to switch. Maybe you can buy, one time canola when it finishes, buy, coconut. So always switch. Don't stick to one thing, because coconut, we have seen that it is a bit high on saturated fat. So we don't want to only consume that, because every vegetable source has a different, percentage of good fats in it.
Mm-hmm. What are the fruits one should completely avoid? Like you said, sweet potatoes are better than potatoes. I didn't know that. Usually fruits are sweet, so diabetics totally avoid fruits. So what should they avoid and what not to avoid?
Yeah, so, some people, they say, I have diabetes, I can't eat bananas. It's, a lot of people, they avoid bananas because of their high sugar content. But actually, I would not advise them to, remove any fruits, because every color, every fruit have a different, nutrients and different minerals. So, but I would advise them on the way they consume them. So for people with diabetes, they shouldn't have them as a snack by itself, because it simply raises their blood sugar higher.
Today we have Sirine, who's an accomplished dietitian from RAK Diabetes Center, Jumeirah. Well, we were talking about sugar levels, and we of course spoke about what fruits not to eat, which ones to eat. What about maintaining sugar levels, Sirine? How does one maintain sugar levels? You know, the best way to maintain them.
The best way is to not skip any snack. So usually have 2 to 3 snacks a day. This will definitely regulate your blood sugar, because when you don't have a meal for a long time or a small snack, your blood sugar goes a bit down, and once you have something, it shoots up. So try to always have snacks, healthy snacks, so it should be whole wheat, not biscuits and chips and these things. Try to have something that is whole wheat, such as rye crackers, for example, brown bread with a slice of low-fat cheese. All of these are healthy snacks, and that will help, you know, maintaining your sugar.
Sirine, you spoke about bread, whole wheat. All these are carbohydrates. What are the other nutrients one should focus on other than carbohydrates if one is diagnosed with diabetes?
Exactly. So I see a lot of people, you know, they come to my clinic and they say, I don't eat rice and I don't eat bread. So then they tell me, but you know, for snacks I had fried nuts and, you know, sambusak and these things. So it's actually, you know, better to eat carbs than to eat fried things, because diabetic people, they are more prone to having cholesterol and heart problems. So it's not only about the sugar or sweets or rice and pasta. It's also about what oils are you using. Are you using butter, ghee, or are you using olive oil and canola oil? Low fat milk or full fat milk. All of these, they play a role, not only our sugar.
So these little things really make a huge difference.
Totally. You're on Meet the Expert with Anand and Pallavi, and we have Sirine from RAK Diabetes Center, Jumeirah, with us. Thank you so much, Sirine. You've cleared a lot of misconceptions and doubts a lot of people had.
Great.
Yes,
I'm happy.
Sirine. Thank you so much.
Thank you for having me.
Thank you.